Good afternoon, everyone. I'm Betsy Swartz, and I'm Director of the Center for Workplace Mental Health here at the American Psychiatric Association Foundation. And we're really glad that you have joined us today for what we think will be a pretty interesting webinar talking about how employers can respond effectively to their employees who are caregivers. Joining us today, we have a very esteemed panel of speakers, including Marvell Adams, who's the CEO of the Caregiver Action Network, Ellen Christman, who's the Manager of Engagement and Philanthropy for SHRM, the Society for Human Resource Management, and Michelle Martin, who's a Senior VP with Paramount Corporation. And we're very fortunate that each of these panelists can really lend their expertise. And by the end of our hour together, I think hopefully you'll all agree that you've learned something new about best practices employers can offer to make sure that their employees who are caregivers are taken care of. So I'm going to, so you'll see from the agenda that we're going to start out by talking about why employers should care, what's the impact. We're going to talk about a profile of who are employees that are caregivers. And then from SHRM's perspective, what are some of the important HR lessons learned, some key overall findings of best practices, and then we're very fortunate that Michelle is going to describe Paramount's case as a case study because they have outstanding caregiver benefits. I would like to mention that this webinar is being recorded so that we can post it both on our website and on the Caregiver Action Network website. Also, please note that if you have any technical problems or questions, feel free to write them in the chat and we will be monitoring the chat. And also, while we're talking, if you can type in the chat who you're with, maybe what city you're in, and we'd love to have that information for our just for our records. So with that, I think we'll go ahead and begin. Shayla, if we see any technical issues, you can just interrupt us. So I'm going to start by talking about, oh wait, let me see, I've got two different views here. So we're going to start by looking at how many people are caregivers in the United States and why does it make such a difference? First of all, we know that 53 million adults in the United States are actually caregivers. And I think we can all know that that's probably an underestimate because a lot of people don't self-report that they are caregivers or don't even know that they're caregivers. But the cost of that is $34 billion in lost productivity, turnover, and healthcare claims. And perhaps one statistic that should get everyone's attention is that 33% of caregivers report that they either are quitting their job or planning to quit their job due to being overwhelmed by their caregiver responsibilities. And we've seen many various statistics on this last fact that 73%, up to 73% of employees are actually caregivers. We've seen numbers that range anywhere from 25% to 75%. So perhaps Marvell will have better information on that point. But if we look at the next part about why should care, well, number one, employers should care because obviously it's the right thing to do. And we know that we all care as human beings for our coworkers. And also because we know research shows that caregivers have unique strengths. They're certainly able to multitask in a huge way, and they're able to translate the skills that they've learned by caretaking into the workplace. And offering caregiver assistance is really a form of preventive care. It's preventive care for both the retention of the employee as well as prevention for the employee's own health and mental health. And it's an important way of protecting your workforce from a talent management standpoint. Certainly, the cost of an employee leaving is significantly more than being able to offer good caregiver benefits and keeping them. So now I'd like to turn the program over to Marvell Adams, CEO of Caregiver Action Network. Marvell's going to talk a little more about what an actual caregiver looks like. What's the profile? Marvell, I'll turn it over to you. I think you're on mute.
I was sitting here just telling myself, don't do it. And of course it happened. But Betsy, thanks so much for having us today. As Betsy said, my name is Marvell Adams Jr. I serve as CEO of Caregiver Action Network, which is a not-for-profit based in Washington, D.C. that provides nationally supports and services and resources at no cost to family caregivers. And you can find us at caregiveraction.org. So just wanted to talk with you a little bit about, what we see out there when it comes to working caregivers. So, statistics are a stitch in time because when you look at some of the statistics that we usually talk about in 2022, 1 out of every 5 employees has significant caregiving responsibilities at home. And the significant part is the significant part. When you think of caregivers being much more than just someone that is assisting someone physically, it can be a whole host of things, whether it's bringing in someone's mail or mowing their lawn. And so this is the floor and not the ceiling when it comes to caregivers in the home. So, but when you look at individuals that are employed, it doubles a bit from this statistic, at least, in the number of people that are supporting caregivers, that are individuals that are supporting family members or friends or neighbors as a general population. And again, this is most likely underreported. I think the most recent studies have come out was one put out by the Elizabeth Dole Foundation, and it was estimated about 105 million caregivers now, family caregivers across the country. And so being able to recognize those individuals, but also noting that men are now more just as likely as women to identify as caregivers. But, and so any gentleman, don't pat yourself on the back quite yet, though, if you mature. But when you ask women what it entails and what they do as a caregiver from a time spent standpoint, comparison to what a man may identify as their caregiving role and what they do, it still is a very disparate gap that is between what men bring forth to the caregiving realm for families as well as women. Over 50 billion annually spent by businesses on caregiving. I think this is an easy number to accept for folks, and that it may also be underrepresented. But absenteeism and shifts from full-time to part-time, or even just leaving work or just workday interruptions, those really do add up, even if you aren't replacing those individuals hour by hour when they're not there. So, the other thing that we really wanted to find out, and we did this through a series of focus groups and working with various corporations across the country to not only present information on options to be more supportive of caregivers in the workplace, we also really wanted to find out from them, what is the impact of caregiving while you are working? And so some of the areas are really what you would expect, that there is a physical aspect of this, the chronic stress, which quite frankly flows through every other thing I'm going to say. The chronic stress that really erodes the immune system, making the person more prone to getting ill when viruses go around, can lead to poor health behaviors and outcomes. Emotional, again, the chronic stress, and that contributes to mental health and issues around that. And really, the notion that, not notion, but the fact that 60% of individuals that are caregivers report depression, so 2 to 3 times more than the general population. Financial, and many times this is not seen as being, a aspect of it that is thought of readily, because you spend, $5 here, $10 there, tank of gas there, and it adds up very quickly. And so the financial aspect is pretty significant. Interpersonal, for sure. Isolation, whether we talk with individuals that are plumbers to housekeepers to CEOs, or even sometimes celebrities that have had roles as caregivers, every single time they underestimate and don't see coming the social isolation that can take place. And so we always make sure to talk about that when we talk about self-care. And then occupational, just the fact of the absenteeism and leaving the workforce that I mentioned earlier. These are the companies that we worked with, just to give you a sense of what where some of this data is coming from. But also what we do is we work with employers like these and many others to really pull together, okay, how can we be a really good resource for employers in a turnkey way? And so one of the ways that we do that is we, with these organizations and others, do regular webinars and events with them. Back in 2023, we did that for over 500 families and have doubled that each year since then. And a big part of that is us educating individuals about not just caregiving, but what it's like being a caregiver in the workplace. I think if you could go to the next slide. I realized I was talking on the next slide yet, but and so just to wrap up, but the we talk about caregiving on the clock, and as well as giving supervisors guidance on how to be, a understanding, hospitable, or even making accommodations as a manager, because as we saw from the statistics earlier, it does not equate to the good for the organization to have turnover in many of these positions, because it's not a guarantee that you find the talent afterwards, and also the cost of just the turnover. We talk about caregiving during the holidays. We're going to that period of time where it really becomes more difficult. Next slide, please. And then just making sure that we keep it brief, as well as utilizing other tools we have at caregiveraction.org. What can you do as a family caregiver of employees? Really making sure to they understand their benefits, making sure they have access to potentially support groups, and each of these areas that really in support are things that we do at Caregiver Action Network. So just let us know if we can be of any guidance to you. And then last, I think it's just a slide with our additional information. We have a help desk that is open to the public for no cost, 855-227-3640. And you can connect with us online. So thanks so much. I think I'm turning it back over to Betsy.
Thank you, Marvell. It's really great information, and I'm sure we'll have more questions for you in a minute. Now I'd like to invite Ellen from SHRM to our perspective about the role of caregivers in the workplace.
Oh, thank you so much, Betsy. Yep. And I do not have slides, but we have plenty to come, and we can send them to you as a follow-up. So for those of you who don't know, SHRM is the world's largest HR professional society. We have 340,000 members, and we touch the lives of over 362 million workers and their families a day. So a very large platform to accelerate change. And what has happened in the past year is our membership, from our chief human resource officers to people who are just starting the profession out of college or out of high school, have been saying, we do not know what to do about this caregiver crisis, and we would love SHRM's leadership. And SHRM had started something a couple of years ago in the policy realm around Generation Cares. And it was a focus on caring for older relatives that employees were, doing, but it failed. We just did not get the momentum that we thought we would a couple of years ago. But now we're in a place where everybody is talking about this. And it's a very pivotal moment in time as we're seeing the aging population, and we're seeing the impact on employees and the sandwich generation. Employees dropping off children at school and then picking up an older adult in their life from adult daycare, etc. So this is no longer something that can be ignored or something that we can fail at. So we decided to really look at this as we're heading into 2025 in three ways. a programming way, producing programs that can inform policy through philanthropy. So I sit at the SHRM Foundation, which is the nonprofit arm of SHRM, and we have been charged in getting together thought leadership around this issue, putting together programmatic solutions, and then pushing policy with our government affairs department at SHRM around caregiving. And we are going to be focusing on caregiving for older adults. So what we have also surveyed with our membership is that 88% of HR professionals say that their companies take a reactive approach to addressing adult and elder caregiving needs. And this has real consequences on business, as Marvell just shared in his excellent statistics. We are losing money because these caregivers cannot do this all. So what we've also seen is those companies that we're highlighting have a 75% higher retention rate when they implement proactive caregiving policies. So that's enough for us. We've got the momentum. We've got the people that we're working with, including your amazing organization, and we will be pushing this all through in 2025. We don't have time to waste. We can't admire the problem. We have to go forward with solutions, and we want everybody at the table to help us. So that is where SHRM is, and we can't wait to work with all of you in terms of getting these solutions advanced. Thank you, Betsy.
Thank you, Ellen. Ellen's going to have to leave us early in a little while, so if you have questions specifically about SHRM, please go ahead and write them in the chat now. And we'd like to shift gears and talk a little bit about what are the best practices that can really make a difference in a company. Oops, wait a minute. And I should say in the beginning that the impetus for this webinar really is the culmination of a year's worth of work that the APA Foundation Center for Workplace Mental Health has been doing. We had a number of focus groups interviewing a very wide range of people who are employees that are caregivers to listen to them and hear from their perspective what would make their lives easier as an employee. And the document that we're releasing today, which I'll show you at the end of our discussion, is an overview of what are those best practices and what are the overall needs that they expressed. So some of those, a very high level of what best practices include. Number one, obviously, is offering flexible work arrangements and time off whenever possible. We realize that, especially in smaller businesses, that may be more difficult, but wherever possible, that's important. And creating a culture that's supportive of caregivers. A lot of caregivers are afraid to even acknowledge in the workplace that they are a caregiver for fear of what that might mean for their advancement. So creating that very open culture that supports caregivers and providing a comprehensive ranging of benefits and programs. I think you'll be really impressed when you hear from Michelle about the array of services that Paramount offers. And then last, but certainly not least, is training managers to know how to be empathetic. And you know, we all think it's common sense, but we also know that it's really not common sense. And I know here at APA Foundation, we offer a training specifically for managers that helps them understand and recognize when an employee might be struggling with a mental health issue and how they can be most helpful in their response. So now I'd like to turn the program over to Michelle Martin, who can talk about the amazing experience of what Paramount is offering.
Great. Thanks so much, Betsy. It's great to be here with everyone today. And the flexible work arrangements and culture, as you noted, leading up to this, I think is key. So we'll talk a little bit about what we do here at Paramount. We see that we do what we can, where we can. So we really do listen to our employees, we see what's needed, and we build solutions that may address only one or two people that, have come up, or it may be solutions that, impact a larger group. But we do everything that we can wherever we can. Paramount is a large global organization. We have employees in most states, mostly New York and LA, but we have employees in most states, and many employees outside the United States. So when we say we do what we can where we can, I'm sure you all know with different leave laws and PTO that can't necessarily do everything everywhere. So when I'm talking today, I'm going to talk about our US benefit program for our full-time staff employees. And that starting out is the paid time off. I think that's one of the most important benefits that we offer for our caregivers. We offer 6 weeks paid leave for someone to care for someone who is seriously ill or just needs help, so you can take time off to care for a parent, a spouse, someone who needs help. And then we also have flexible and hybrid work arrangements. And a lot of that came out of the pandemic. I think most of us are probably hybrid, if not fully remote now. But that has been, I think, a big help to caregivers, not only for adult care, for child care too. We're hearing that from employees. Not that you want to say good things came out of the pandemic, but in people's minds, the workplace flexibility, that might have been a good thing. We offer people real live help. So what we do hear from employees is that they don't need more apps. We do offer a lot of apps, and they're very good, and they can help people, especially like our emotional health apps. But there are times you need real live people. And we partner with Bright Horizons, so we offer adult backup care and child care. The adult care, something that has come up and helped us evolve our program, is first that it used to be so you could come to work. So you would use your adult care, let's say a parent had surgery and you need some help in the home. You need to get to work, you can't be there, so you would use the Bright Horizons backup adult care. What we found is there are plenty of employees that are living alone and may need help on their own. Maybe they're the ones having surgery. So we've really expanded the use of our Bright Horizons backup care program. So you can use it for yourself. You can use it for a spouse, adult child, adult in another state. The other thing that came up was helping when someone is seriously ill and needs support in the home and I'm going to do this as an example. So we're calling it our compassionate care program. And how we developed it was an employee whose spouse was going through chemotherapy. They didn't actually need the care for their spouse, but the spouse was unable to care for their children after treatments. So they were using the backup child care to help the spouse when they had their treatments, help them take care of the children. And how it was brought up to me is someone came back and said, listen, I want to tell you how great this program has been. I ran out of days. So we give employees, they get 25 days per dependent, which is pretty high number. But they ran out of their days and they weren't asking for more, which was nice. They were just thanking us that it was available. And I thought, wow, we didn't really expect it to be used like this. And how can we even make it better? How can we make sure they have all the days they need for someone who's going through a serious illness, a cancer treatment or other serious illness? So we expanded a compassionate care program and added days. So now they get an additional 15 days on top of their 25 to use in those situations. And that has really helped a lot of people. And again, they can use it for themselves. They can use it for parents, in-laws, siblings, whoever they need help caring for. We also have a program that is an elder care management program. And that one, you have a live coach that helps you come up with a caregiving plan for let's say your parent. they will do a free in-home assessment. So if you're trying to decide, like, is my parent able to stay in the house, or do we have to find alternative living arrangements? We'll do that in-home assessment at no cost to the employee. You get a coach who will help you look at what's the important factors in those decisions. Maybe you are going to keep them in their home. What, you know, do you need rails in the bathroom? What do you need to make that happen? So you get a real live person there, along with a whole system and a calendar, and helps you keep your medical appointments all together. You can invite siblings and others who are helping a part of that care management program to that platform. Then the other thing that comes up a lot is Health Advocate. They are a great resource. We find them used most for parents' Medicare claims. So when they're trying to get something covered through Medicare, or understand claims, or get medical services, even things like, you know, getting to and from doctor's appointments. Health Advocate's a great resource for that. Employees have access to that, and they can use it. Their parents can use it. Their in-laws can use it. So whoever they're caring for has access. Then there's the emotional support part of this. We know there's a lot to do tactically. The emotional part is just, I mean, it's so much to deal with. It could be so overwhelming. We offer an employee assistance program that includes virtual and on-site employee assistance in some of our large locations. We offer a Headspace, which you see behind me. That is the app. Headspace is meditation mindfulness app. We also offer Headspace Care, where they can text with a live person. And then we offer Thrive, which is also an app, and it's a resilience program. And then what you see, the images up here, one of the most important things, and I think it was touched on through a few people that spoke before me, is that support from the community, your peer-to-peer support. We have an employee resource groups for parents and caregivers. And you can see here, they put out a toolkit. And this really gets to that manager issue, that culture issue. So we give points in this toolkit, and it's I don't know how many pages. We'll do webinars on it. We go through this, and we really engage with that employee resource group. But you can see here, they give some tips on how you can support your parents and caregiving colleagues. And I think with that, Betsy, I'm done with my quick overview, but open to questions if anybody has any.
I'm sure there'll be questions for you. Thank you, Michelle. I think we all want to go work for Paramount. So let's see, given our time, I think that I'll quickly go through this. Oops. So some of the best practices that I'm going to fast forward a minute and just show you. This is the new resource that we're coming out with today. That's the result of the grant from Alchemy's Pharmaceutical. And this is where we summarize everything that we found over the last year in our focus groups with employers and caregivers. And this is a quick overview of what the content of the guide is. But included in the guide are some best practices. And I think you've heard all of these mentioned in our previous presentations. But I think just to highlight a couple of them, number one is to conduct an assessment. We all think we know what's right for everyone. Actually, I just got back from a 2-day training in design thinking, where we started with the person that would be most affected by whatever we're creating. And we really do a deep dive into understanding who they are and what they need, and not make any assumptions about what we think is they need or what is best for them. So we encourage people to first do a real assessment and get a clear handle on what your employees who are caregivers really want from the employer. And as Michelle just mentioned, we also found in a number of companies that having caregiver employee resource groups are very helpful and can go a long way in creating that peer support that we know is so important. And then as Michelle just mentioned, having people know about the benefits that they have available to them in terms of health benefits or paid family or medical leave, and leveraging the power of storytelling. Perhaps nothing can be more helpful than especially hearing from managers or leaders or from other colleagues that they've been through this and you're not going through this alone. And the level of feeling overwhelmed, if you can hear from your colleagues how they dealt with that level of being overwhelmed and what worked for them, and maybe some of that will work for you. And we've talked to a number of corporate CEOs who were caregivers themselves, and they talked about how their lives could have been different if it was really normalized in the workplace by having other people talk about their own personal experience. So that's really quite an important best practice. And as we just discussed, offering flexible work arrangements. Again, wherever possible, you know, if it's a very small business that might be more limited than in a very large corporation. But one best practice that we heard, which I thought was really interesting, is that people can donate their time off to other employees that might need it. If they don't need it, it can be a really wonderful shift in the culture to say that I'm giving my paid time off to someone else because I know they need it. Being able to roll over PTO and having a company match program. All of these things, job sharing can be an important way of being able to let a caregiver manage their workload. And of course, hybrid is a big thing, especially in a post-COVID world. Providing a comprehensive range of benefits. And as we said earlier, training managers to understand what really can be helpful for their employees. So again, here is the overview of our new playbook, guidebook, and it will be posted on our website starting tomorrow, along with the recording of this video. So now we'd like to open it up to your questions, and feel free to either take yourself off mute and ask them, or you can certainly type them in the chat. And Shayla, you're going to let us know if we have any in the chat.
Yeah, I just allowed everyone access to unmute and ask questions. So if you'd like to ask a question, the floor is open.
So a question that I usually get while people are getting in here is like 6 weeks of paid leave seems like a lot, and companies are worried, you know, is it going to be abused? Are people going to, you know, use too much time? Is it going to be really expensive? I will say it's not time people abuse. It's a very low utilized program, but when we hear from people who use it, it's so important to them. But you are not getting, like, everybody's not going in and taking 6 weeks off. I mean, they're using it when they need it, and we're not seeing abuse with that program.
Michelle, how were you able to sell leadership on this comprehensive benefit package?
You know, we really, I've been so lucky with our leadership team. You know, even over the years, I've been at CBS, Viacom, CBS, Paramount. It's kind of all the mergers. We have just had the most supportive leadership that it has not been a heavy sell. You know, they kick the tires. We make sure that we're prepared around costs and things, but they understand the need. They understand the value. They are very supportive of our family programs in general. So it's been pretty easy for me, Betsy.
Wonderful. Marvell, from the companies that you've worked with, I'm curious what challenges you've seen they've encountered and how they've overcome them.
There we go. Okay. Some of that comes down to a perception that we find is that, companies that are willing to put the resources, just like Paramount is, to have these additional benefits as well as access to other resources. It's then a matter of making sure that the caregivers that they know are in the workplace identify as a caregiver and see that this is for them. One example comes to mind is a defense contractor that works with us that has 80% of their employee base is male men. And so they have these, great benefits for caregivers, but they find that the 20% of the women that work there are more likely to come out than the men are, even though statistically they know there are more men there. And so, some of the work is around ensuring people understand what caregiving entails, so that they know to reach out for help.
Do either of you know of any data that speaks to how these benefits impact retention, or how the overall effectiveness of, if you compare a group of employees who have no caregiving benefit to a group of employees that have a rich array of services?
I can't speak to exact numbers. We certainly believe that it does play into retention. Where it comes up a lot is our workplace award applications. So, we're on a lot of best place to work for working parents, best place to work for, all different categories. And the pay time off question comes up the most. So I know that employees that does, it helps with attraction and retention. Just knowing that's available, but I don't have a specific number.
Michelle,
One question that we have is around employee resource groups and kind of how to build one around caregiving and what that would look like. Do either of you have any insider experience with those?
We have a parents and caregiver group. It's both in one group. And, the experience, I would say, what makes them really impactful are the people who get involved, the employees. When they're really employee-led, I mean, we are supportive. They have access to us. We help them get speakers and put on events and get information out there. We listen to them and use their feedback. But you have the employees that really lead it. I feel like that's what makes them so successful.
Yeah. And we have some companies we work with that have, all types of affinity groups. But one that stands out is an intergenerational affinity group. So that brings together individuals across the company. It's a nationwide company that have either intergenerational families, or grandships, kinships, so where there really is a lot of intergenerational engagement and understanding. When you're a sandwich generation, or Gen Xer, and you have an older adult that you're caring for, as well as, children, even though they may be grown children that you still have a responsibility for, that is an intergenerational dynamic that is unique within caregiving.
It makes me think about one of a gentleman who was in one of our focus groups, who was in the C-suite of a Fortune 500 finance company, and taking care of an adult son with very serious addiction issues. And he spoke about how difficult it was, how much he felt like the Lone Ranger, and he really wasn't comfortable discussing it with his colleagues. And that is something, if an ERG group really created that level of normalization and giving permission to acknowledge that this is real life, that could make a big difference. Shayla, are there other questions or comments? You don't have to have a question. If you have any comments that you'd like to add of things that you've seen work, we'd love to hear it.
this is actually a question from me. A lot of times when caregiving starts out within an organization, there's a heavy emphasis on elder care and child care. Have you helped any organizations, or Michelle within your organization, kind of turn the focus as well to adult caregiving, to mental health caregiving, anything like that?
So, I mean, we do focus very, specific topics and then kind of, in grouping things together. So, I'm not really sure what the question though, Shayla.
So like on top of elder and, childcare, how do you make outreach to the people that are caring for those in between populations?
Oh, I mean, I think that comes to our communication strategy in general. So we use everything because there's trying to get the information to people when they need it is always a challenge. So we use Slack, we use home mailers, we use emails. In-person events are really good. Information tables, health fairs, benefit fairs. We'll even have like vendors, some benefit vendors at our holiday fair, where we think it kind of fits in. So we just try to keep things in front of people as best we can and know that we're there to support them. And then I love the multi-generational example. I thought that was really, really good. We'll focus specifically on adolescents, in different pockets at different times.
Great, wonderful. So Shayla, if there aren't any other questions in the chat, I think that we can give you back 15 minutes in your schedules. And just want to thank you again for joining us today. And if you have coworkers that you'd like to share this with, please do come to our website or to the Caregiver Action Network's website, and there'll be both a recording of this webinar along with the new corporate playbook that we'll be releasing tomorrow. So again, thank you to our panelists for a very wonderful discussion, and thank you to all of you for joining us, and enjoy the rest of your afternoon.